So the driving pressure or the delta P is equal to P plat minus PEEP, which is equal to tidal volume by compliance, right? There will be two situations. We have a more compliant lung. When the compliance is more, we can give more tidal volume. So tidal volume will be more, or you can give tidal volume that is less. You can give a tidal volume that is more or that is high or less. So in these two situations, what will happen? Compliance is more, tidal volume more. So the delta P may remain same, or if you are using tidal volume less, in case of compliance more, the delta P may decrease also. So both the situations are actually favorable. Of course, this is desirable. However, if you have a less compliant lung, so this CST is very low. We are dealing with a stiff lung, and in that stiff lung, you are giving a high tidal volume. So what will happen? The delta P will actually increase. That means you are giving a high tidal volume to a stiff lung. So there will be higher chances of villi. So there will be increased mortality. So a study has been done by Amato group of people, and what they have found, we'll just tabulate it, right? So the PEEP is there, P plat, delta P, and mortality. If the PEEP remains same and the P plat starts increasing, that means the lung is getting bad. You are not changing the PEEP, but the P plat is increasing. That means the lung is getting bad. There is more de-recruited lung, there is more consolidated lung. So in this situation, the delta P will be high, and it implies increased mortality. However, if the PEEP is rising, you are increasing the PEEP to maintain the saturation or the oxygenation. At the same time, the P plat also increases, rising. With the rising PEEP, the P plat is also rising. That means the PEEP is actually not helping the patient. Right? In this situation, the delta P remains the same, but there is no change in mortality. What is desirable is the last one. When you increase the PEEP is rising, but the P plat is actually false. That means the increase in PEEP actually helping the patient in de-recruiting the lung, so that the compliance with the lung is getting better. So in this situation, the delta P will be decreased. So this actually decreases the mortality. That is what we desire. So in the study, they found out a delta P or driving pressure of less than 14 centimeter water, it actually improves mortality.